Okay, so 4 different neurological diseases, all pretty complicated. So we're kind of just getting to the, we're really doing basic medical management and pathophys, and we're concentrating on the nursing interventions, which are actually pretty similar across the disease state. Okay, so that way. Okay, so we're starting with multiple sclerosis, very common. I'm sure you guys probably all know someone who has MS, or have taken care of a patient who has it in their history. Hopefully not the reason that they're primarily in the hospital. So MS is a chronic autoimmune disorder. It's a degenerative disorder of the central nervous system. So when you say central nervous system, what does that include?
The brain, the spinal cord.
And what happens is the myelin sheath is damaged. So the myelin sheath is, I think of it sort of like the insulation around a wire. Okay? So the myelin sheath covers the axon here. Okay? So we have our cell, our neuron, our axon here. This is the myelin sheath that surrounds it. And so this myelin sheath gets destroyed, it gets damaged, the nerve gets inflamed, and this axonal body can eventually be damaged as well. Okay, so let me just show you guys how to figure it out now. But, so what happens is the myelin sheath around the axonal body gets destroyed, gets inflamed, and then eventually you can actually have damage to the axonal body itself. Okay, so we call it demyelinating disease. Demyelinating means the myelin gets destroyed. Okay, and so myelin is actually a fatty and proteinous material that surrounds the fibers, the nerve fibers. Okay, so what results is that we have impaired transmission of nerve impulses. And so like in all autoimmune disorders, we attempt to treat the immune system so it's not as reactive. Okay, so what's the etiology? The etiology is we really don't know. Okay, so like many of these things, there's a question that it may be sort of brought on when the patient gets a virus. So they have some sort of exposure which triggers it, but likely they have a genetic predisposition to having it. So they do see it more commonly in families, but not all identical twins will have it. So they know it's not 100% genetic. There is an increased risk in Caucasians of Northern European descent. So we see a lot of it in the U.S. Okay, most people that get this are women. Okay, much higher rates in women, and usually the onset is age 20 to 40. If you're a man that gets MS, you have a worse prognosis. Okay, and actually, interestingly enough, the later in life you get it, you have a worse prognosis. I would think it would be the opposite of earlier. But male later in life will have a worse prognosis. Okay, so there's 4 types of MS. And 85% of people have what's called relapsing remitting. And so what this means is the patient has acute attacks, but they go back to their baseline in between. Okay. About 15% have one of the remainders. So they can have primary progressive, which you'll see abbreviated as PP, and these people have a steady decline. Secondary progressive, which means they have acute attacks, but they have progression in between at a variable rate. I'm going to have a voice today, obviously. Okay, sorry, let me get water. I'll be right back.
She's on cough drops. Oh, that's what you're looking for? Last time she needed them.
Arugula. Hand this to her. This will help you out. Give her some macarons.
I did. She ain't on.
No.